trying to figure out, should I go to the stretch lab?
I
You
think
know, it's like I'm
also
getting older.
more
Let's get a quick
cool
assessment real quick.
being
Just see.
higher on the treadmill than on the bike.
It's relaxing.
Yeah.
I don't know why, it's like something about sitting down instead of. But I mean, I feel like I was going just as hard at the end on the bike, like physically it feels that hard. But
Yeah, yeah.
I know my heart rate went on the bike, it was like at least 10 beats slower.
Yeah.
Test this out real quick.
Well, yeah, I think,
All right.
yeah, push you, next week,
So
we'll set up
take a
a
deep
Zoom
breath
meeting,
for me.
go over both reports.
Yeah.
Cool.
And, I'll give you like a training program.
Will I be taller when we get done?
Yeah.
Maybe if you're
Going to
consistent,
dead
I would
now
say,
tonight.
yeah, definitely.
Still
But
get tickets.
one thing
You
that
going to
I would
Dead
say,
Mountain?
Yeah.
the first
Okay,
sessions,
I'll
should
be
this
there.
type of demo where, you know,
Yeah,
like,
yeah,
10,
yeah.
15
Yeah,
minutes.
so text me.
It's more of an
or on
introduction.
Instagram.
Yeah,
If anything, to what
Yeah, cool.
Yeah.
help
Yeah.
you with.
When you told
So
me,
if
I
you're
was
help-
like,
you're looking to
yeah, I
use
told
this
my
as like a
friend.
recovery tool,
Oh, nice.
or just kind of staying mobile and flexible, I think this is great. Kind of incorporate what you're doing.
Yeah, sure, sure.
You know,
Yeah,
you're
so
running
that's,
so often,
Manager.
your body sometimes doesn't get that
Yeah.
recovery from, you know, this besides, I don't know.
Yeah, I started just running 3 times a week instead of the 4.
Alright.
So I just do 3
Yeah.
times a week, because since I had these injuries,
Give me a few minutes to recalibrate.
yeah, of course, feel that in that hip flexor.
I wanted to get the, or at least try the, what is this? Very cool.
Yeah, like Metaspeed Sky.
Yeah.
What size do you wear?
9.
Let me see what we got.
Where do you feel that?
Yep,
You feel it
right here.
Yep.
I'm old and stiff.
No, I think that's a great thing about this, is, you know, it's more like a gentle, it's not a chiropractor where you're breaking, you know, bones.
I know. 'Cause they're just like, I'm like, ooh, that, I feel like I'm gonna be taller.
Yeah. Deep breath.
So I don't have a 9, unfortunately. I have a 9.5 if you want to try this one. Yeah, it's
Yeah, so I think a lot of people who usually take this, you know, they start people from young as like teens to like 70, 80 years old. So a lot of the time they're coming in for
on the calendar.
a way to, like I said, use this as a tool set to with their goals, whether if it's training during the off season or they just want to be more flexible, mobile.
Well, my thing is, I don't want my gait to be old. I don't want to be walking like bent over when I'm 70.
Yeah.
Yeah. I mean,
My
you
great
will
aunt
notice
just
a
turned
big
99,
difference
and
especially
we have longevity in our
in a shoe
family,
like this.
and she still walks really,
Also,
you know,
these
she's
fit
pretty
snug.
straight up,
So
not
the
bent.
9.5 could
So
work.
I'm like, I'm trying, that's my goal. It's like, I don't want to be,
And it looks like
you know,
you're
some
rocking
older people
the
you see, they got
Brooks Adrenalines
osteoporosis,
Mhm.
they're walking weird.
Yeah.
So it's my desire not to walk that way as I get older.
Right?
John, I forgot.
Oh, sorry.
Yeah, completely forgot.
I keep forgetting that.
Thank God you wanted to buy shoes.
Deep breath. Down.
You feel that one?
So right there, back. More.
Yeah. These lights, yeah, they're not like super tight, but they're not like slipping that much. Yeah.
Do you mind if I just check your toes? I'm
Yeah.
just kind
Yeah,
of curious.
just for me, I'm more mobile. I have a studio in Baltimore,
Okay.
but I'm actually mobile, so I go to people's homes doing this.
So,
If anything, I
What
would
if it's
go
a
up
30-minute
and
or a
outside.
60-minute
okay,
session?
okay.
I think
So
the
how
9
how often should I
I
be
mean,
doing
if you were
this?
in a size
Well,
9,
I
you'd
think
be
it depending on a lot of factors. One thing is probably just your availability, you know, so let's say if you're, and like how often you're working out or active. If you're running, let's say, you know, like twice a week, 2 to 3 times a week, probably starting off just so that your body kind of gets used to it. I recommend probably just doing at least 2 sessions a week until your body kind of gets used to it, and you can see like where you might need more work done. Relax.
Okay.
So a lot of times, I'd say, you know, active people, they want to use this to do this on their off time, whether if they're not running, or if you just want to do it as a once a week thing. It's totally customizable. And so a lot of people, I would say, just kind of looking to, you know, see how this can help them. Let's say we should have done a test prior to, so you can kind of feel the difference before and after.
I can feel the difference already in how you stretching. Especially when you do those, I was like, okay, I think I'm getting taller.
Yeah. Where do you feel it? Do you feel it more in your hip right there?
I feel it.
Back.
Yeah, I'm kind of in my abdominal a little bit.
Okay.
That's probably why athletes can athlete so long or play so long.
Since you came in with Johnson,
Definitely.
I think we're moving 10%.
Longevity has to do it, you know.
Take care of your body, yeah.
Your body does so much for you that
Next
you,
time you shop,
sometimes I think we don't take care of our body too.
Yeah.
Well, what's really weird is like, remember in the 40s and the 50s, people weren't like at the gym being gym rats. They were still skinny.
Yeah.
They were, you know, but it seems like now, I guess it's like the food that we have that's just like killing us.
High processed food, sugar, different kind of bad oils that we eat, definitely. There's a lot of factors, I feel like, that.
Because the food just isn't what it used to be. Vegetables got so many pesticides on, it's like all the nutrients are gone.
So true. Deep breath.
I'm stiff.
Okay, good. So have you ever done like any physical therapy or chiropractic? Or
Physical therapy mostly for my rotator cuff, my arm. And then when I broke this left foot a couple of times.
like any like massage therapy, you know?
Yeah, I did with this. This foot was just so bad because I was in a cast for 9 months.
Oof.
I had like frozen foot, so I had to go to a sports medicine and get it. That was back in like 2002.
Okay.
But it was the worst. And now this foot is bigger than the other one.
Deeper.
This would be so cool to do this after a race.
Oh, perfect. Yeah. I'm hoping to get into more racing events around here. Just kind of posting up, you know,
Okay.
giving people
Already?
at least a quick demo.
Yeah, because the Army 10 miler is tomorrow. I did it last year, but I'm not doing it this year because I didn't train because of this calf thing. So I just started getting back out there a couple weeks ago.
Yeah.
Because my doctor was like, don't do anything.
Improve your VO2 max. It's, I mean, out of all the.
How was that Chicago run?
It was cool. It was
It
just cold as heck because, you know, it's
Already
usually,
at this time of the year.
well, it was in September, and usually in Chicago it's not that cold. But it was a little chilly at the start.
No matter what. I mean, there's no
But it's the Run Mag Mile, so basically they shut down the Magnificent Mile. It's the only race they shut it down for. And so they had a 5K, a 10K, a
Okay.
10-miler and a half.
So I'm active duty right
And I did
now,
the
but
10-miler.
for the last like 10 years, you know, you get accustomed to.
That's my sweet spot. I'm not
So
trying. I'm too old. I'm not trying to run marathons.
Within reason, I have a lot of.
Half is as far as I'm going. I have no desire to be running 26.2 miles.
What are
I
your,
used to do like Olympic lifting,
Okay.
ultra marathons.
What did you
but
do
now
for
it's, like,
occupation
walk a lot.
or?
I'm an attorney.
I'm trying to
Okay.
get back into swimming. I
How long
got
have you
surgery
been
a couple
practicing?
months ago, so,
Too long.
log, some light lifting.
That's something you always wanted to do growing up?
Yeah.
okay.
I wanna get back into running.
Yeah,
I'm
it was.
pretty sure that I have like a hip
But
and a big
I'm trying to get out, man.
What's the hip thing?
I'm
It
thinking in the
feels
next
like
5
tear,
years, I'm
like a
retiring.
labral tear, so
Okay.
I'm trying to like manage it with like hip strengthening exercises.
I wish I could retire
I can
now.
still run, it doesn't
Do you have
bother
any,
me, it's
Yeah.
just there's like.
Specialty, I don't know what you
Got
guys
it.
call it.
Employment.
Got it.
Employment and business.
Okay.
Do a lot of
Yeah.
business
How long
startups.
ago was that?
I don't know, I just noticed.
And
it
then
a couple
a lot of
weeks ago.
people
Okay,
that have
got it,
issues at
got
their
it. Okay,
jobs,
okay.
I handle them or if they
Okay.
get terminated, pretty much.
So for your VO2 max,
Yeah.
I assume you don't take, right?
No.
Okay. Because some medicines will affect the VO2 max, like beta blockers.
Oh yeah, no, I don't take those, I didn't have any caffeine.
Okay, good.
Yeah, so one thing I
So the
always
point
tell
of the
people
VO2
if they never had like
max
this type of
is
fascia
pushing
stretch
VO2
therapy
max.
is
I
we're
mean, that's the
stretching
whole point,
fascia,
right?
which basically kind of
So that being
encompasses
said,
your muscles, your tendons, your it's a connected tissue that
you're
goes
gonna
from head to toe.
want to quit in the middle.
And it plays a lot of
let me
effect,
explain how
plays a
this
big
works,
role in
okay?
like especially the nervous
So we have
system.
a warm up.
So if
that
you ever had
the-
like
the
tightness,
actual
you know,
test is gonna be done.
sometimes
The
people
warm up is
will
gonna
say
be
my
4
hips
minutes
are
long.
tight or my ankles or
The
knees.
goal is for your heart
The
rate
fascia
to be
runs basically
less
from
than
like I said, head to
100.
toe.
So
And,
I'll die pad in front of you.
It could affect here, but it
we'll
could
do,
actually
like,
be
speed
down
2.5
as low as your ankle or
to
all the way
3
up to the shoulder
for
or
4
your neck.
minutes, just for
And what I'm
everything
doing
to,
here is
you
just
know,
kind of releasing,
get to know you.
giving some space, releasing tension for a
and
lot
then
of
we'll
that
start the
fascia so
actual
that I can
test.
do its work.
Okay, so
Which is
so I
meant
need
to-
at least 8 different intensities,
Keep everything in
Meaning
place
it's eight,
and give it structure. So how I explained to you
separate
was like
1-minute intervals.
if you ever cut into
Okay.
a chicken,
So
you
for
know,
example,
and that little white
the warm up's at 3. I'll
tissue
push you
thing that
Mhm.
that covers the tip of the chicken.
Mhm.
and then
The
That's-
film.
4.5,
Yeah, that's
5.
basically what fascia is.
And then at
Or
the
like a
end
saran
of
wrap.
the
If you
minute,
ever
I'm
hold
not
hold
gonna
on a
talk to
saran
you
wrap on
because
one
you're gonna
end,
be like,
Mhm.
typically
You know what I mean?
one side gets
So
taut
this
and then the other
means
side gets
keep the
loose.
same speed.
And it's the same thing with here. So
This
we
means
feel a lot of
I'm okay if
hip
you go
flexors.
5.
That could be very tight.
And at the
but
end, this means
if you
like
kind of
stop.
connect
You can do
from
this
the
at
head
any point
all the
and
way
I'll
to your
stop the
ankle,
test. Which
or
means
all the way across your
I'm
arms.
going to reduce the
It's just
speed.
one of those
If
things
at any
I
point
think
you can't wait
we're
for that,
learning more
just
about
hop,
as
like
the years go by.
do that. That being
More
said,
like
if
science.
at any
Well,
point
my aunt
you
says that she
feel
stretches
uncomfortable
before she
by
gets out of bed every morning. I'm like, oh,
stop,
okay,
do
Aunt
this.
Shirley, is that what the key is to being
Um,
99?
That being said,
But she's so funny because
like
she
I
walks
said,
on her
I'm gonna-
treadmill
I'm
with her
gonna
eyes
push you.
closed. I'm like, you're gonna fall.
What's max is
She's like, I'm concentrating. It's like,
So-
okay. We're like,
yeah.
but she's still walking like
So
2.7.
it's pretty
I
much
think that's
220
pretty
minus your
good
age
Yeah.
for the maximum heart
for a
rate.
99-year-old.
But that being said, it's that versus
Take a deep
it's
breath.
called the rate of perceived
Yeah.
maximal exertion, meaning if I'm like looking at you
Mm.
and then you're like I can tell that you're at your max.
Take a deep breath.
It's like a gestalt feeling I have, like intuition because of the experience.
Yeah.
I've done this. But that being said, that's pretty much the way to do it. That being said, do you have any questions about what I said, concerns?
Is it incline or are you just doing speed?
Speed.
Okay.
The speed, the limit is 12.
Okay.
Yeah, I know, exactly, yeah. But let's say like, it's one of those days and you hit 12, then I'll go up on the incline.
Okay,
Okay.
got it.
Doing okay now?
That being said, at the end of the session,
It was really great.
I'm gonna review it, make sure everything's okay on the
I'll
charts.
probably be sore
And
tomorrow.
then next week, we're gonna set up a Zoom call.
good tonight
So
Mhm.
we go over everything in depth. And if there's anything like concerning, I'll let you know. And then I'll give you like a training program to improve
We set your
VO2
plan,
max.
spin your
So we
leg.
can retrack it and
Squeeze in.
whenever we want, people do it. People try to wait at least 3 months.
Okay.
But if you want
One
6
more
months,
time.
9 months, whatever you want, but 3 months is a good
Let's get up for a
trust.
second. Pelvis
Okay.
curve. 1, 2, 3.
Ready?
Yeah.
Yeah, let's do this.
Is the nose plugged for the, I guess it's.
Okay, I forgot to tell you about the max, my bad. Okay. So.
And then you tell me to step off the table